Okay, we're going to jump right in. Now, our next session is presented by Dr. Daniel Vicario. So Dr. Vicario, you want to take it away?
Yes, thank you so much. What a great presentation, my dear colleague, Dr. Ash. And I'm just very grateful for the opportunity to speak today, and actually to each one of you for taking time to attend this meeting. It is my honor to be with you, and I'm really excited to be here because I've worked very closely with naturopathic doctors for decades as a medical oncologist, and I've really learned so much from NDs. I've seen how much they help and support those with cancer before, during, and after conventional medical treatments. So I definitely know you're a fantastic audience. I've given this presentation to my oncology colleagues for many years, and even though I enjoy doing so, they tend to be a tough crowd, mostly because their mind is so set on molecular oncology, chemotherapy, new treatments. I mean, I could go on. And then they really don't have the bandwidth or the interest to open up to the universe of integrative medicine. So integrative oncology is a very extensive topic, and it's been a passion of mine for several decades. It really has been my honor and privilege to work with cancer patients for 35 years. I've really learned so much from them, I can't tell you. This integrative oncology presentation would take at least a couple of hours just to scratch the surface. So I really want to apologize in advance for the many slides, and you have the slides and you're gonna have the recording too. But there's so much to share and cover. For the first several minutes, I would like to share some key oncology concepts, and then we'll move into the integrative section. My goal is really for you to not only hear about integrative oncology from an oncologist perspective, because you've worked with oncologists for many years, but so you can have a few more tools when you are communicating with my colleagues who sometimes are difficult. All the medical, surgical, and radiation oncologists, they're so much in the box of science. They're doing an incredible job in their environment of science and medicine. Fortunately, Dr. Bill Warnock will be giving his presentation after mine. He'll be covering several topics, and I'll defer to his wisdom and expertise about so many things he has to say. So I'm going to go ahead and start here. Our learning objectives are cancer and its causes, advances in medicine and science, genomic oncology, evolving cancer treatments, epigenetics, definition, importance, and benefits of integrative oncology, complementary modalities that improve the quality of life in cancer patients. There are countless scientific articles that have been published, empowering ways to look at cancer and its treatment, and for integrative practitioners and healthcare professionals, the importance of taking care of ourselves. So most importantly, it's supporting cancer patients in their healing journey. So let's just close our eyes for a few seconds. We all know so many people with cancer. So the intention really for us is to bring into this gathering our family members, our loved ones, our friends, co-workers, clients, and patients who have or had cancer. We can honor them and hold them in our hearts. And every time I give this presentation, I can't tell you how many times I think of all the people I've worked with, and I hold them close to my heart. So very briefly, what is cancer? It's a disease in which some of the body's cells grow uncontrollably. It can start anywhere in the body in trillions of cells. It really doesn't follow any normal division, growth, or apoptosis signals. It tricks the immune system. Each person's cancer has really a unique combination of genetic changes. And even within the same tumor, this is important, different cells may have different genetic changes. So that's why it really is not one disease, it's multiple diseases. We know that it's heterogeneous, diverse, and complex. not only in types and stages and grades, but from genomic and molecular aspect as well. You've heard of the different types of cancer. You treat the patient with carcinomas, sarcomas, lymphomas, leukemias, melanoma, CNS, myeloma, germ cell. And for example, really, non-small cell lung cancer has it's more than 100 molecular entities. So what causes cancer is multifactorial, you know, about hereditary factors, genetic predisposition, oncogenes that are overexpressed, tumor suppressor genes downregulated, for example, P53, which is really has a lot of, P53 has a lot of functions, really protective functions. DNA repair genes affected, environmental factors, lifestyle, epigenetic, DNA replication. So this is a really good article that I would recommend having available from Science, March 2017. And one of the authors is Dr. Bert Vogelstein, very, very well-respected medical oncologist. And they studied the relationship between the number of normal stem cell divisions and the risk of 17 cancers in 69 countries and information from 423 cancer registries, and found that random mutations are responsible for 2/3 of mutations in human cancers. So for any patient you work with, when they really are confused, they say, why did I get cancer? I mean, I took care of myself and I don't have genetic risks. You could mention that there are these unavoidable random mutations that occur in human cancers. And in those who have the mutations, 2/3 are random. Talking more about cancer metastasis, you know, as cancer spreads and cells can remain dormant for years. You probably have seen patients who had cancer years ago and then show up now, or decades ago, and now show up with a recurrent tumor that shows up in the bone or in the lung and the liver or somewhere else. And these cells remain dormant. So all the work you do as naturopathic doctors are helping patients, especially those who had cancer, to stay healthy and decrease the chance of these cells growing again and decreasing the fertile ground. We work as a team, surgical, medical, and radiation oncologists, but we also work with genomic oncologists and integrative oncology, which is the talk today. So genomic oncology really is a big topic, and I'm just going to mention, you've heard about molecular profiling, genomic profiling, precision therapeutics, genome-driven therapy, personalized therapies, next generation sequencing. So I'm going to be showing you articles from, you see right here, the American Society of Clinical Oncology is the biggest and most important society for all oncologists, medical, surgical, and radiation oncologists, and we call it ASCO. So ASCO had an educational book in 2003 where Dr. Roselle Kurzrock, who was at MD Anderson and now is at UCSD, has done incredible work with molecular profiling. And she talks about, of course, here in this article about cancer driven by molecular processes. And fortunately, revolutionary changes in technology have enabled rapid genomic profiling. And she has here, in this article, talks about molecular aberrations in lung cancer. And this is years ago. So imagine how much has changed now. An old model is we had lung adenocarcinomas. We would treat patients with certain chemotherapies. But now the model that she calls divide and conquer molecular profiling is we have all these different abnormalities, molecular abnormalities, and we can target each one of these with different agents. A lot of them are oral pills now that, you know, and are very, very much better tolerated. So molecular profiling in breast cancer, I'm just going to mention the Oncotype DX that you've heard of. It's widely used. It's genomic-based individualized risk assessment and predicts the likely benefit of chemotherapy. So we're using this in early stage invasive breast cancer in adjuvant and neoadjuvant settings. The rest are the other techniques that are available as well. So from the Journal of Clinical Oncology, from now on, I'm going to mention JCO, which is the main publication of ASCO and the Bible of all oncologists. From May 2017, as they talk about tumor genomic profiling for personalized oncology therapy is being widely applied in clinical practice and clinical trials. And here they looked at out of 155 patients, that 43% of these patients received genomically matched therapy and derived clinical benefits that lasted for 6 months. So global implementation from JCO May 2021, this is another really good article on precision oncology. They talk about the next generation sequencing and how basically it's pushed to the forefront of cancer medicine. So you're going to see a lot of your cancer patients that are on these new therapies now, thanks to this precision oncology. So in oncology, we have new improved medicines, improved chemotherapies. We're far from getting to where we want to be, but it really has improved. There are monoclonal antibodies, you know well, the rituximab used for lymphoma. I had a patient when the rituximab just came out 25 years ago, a commercial pilot who really needed to use all his abilities to fly a large plane, pleaded not to receive any chemotherapy and just a Rituxan. And I said, let's do it, because it was a low-grade lymphoma. He had a complete response, a cure. He had massive involvement all over his body. Fortunately, it was a low grade, and just with Rituxan, he had an outstanding response. 25 years later, he remains cured. And then, you know, trastuzumab for breast cancer and others, targeted molecular therapies, imatinib cures a significant percent of patients with CML, chronic myelogenous leukemia, and all these others for many other cancers. You've heard of Avastin used for several cancers, lenalidomide for multiple myeloma, which is incredible. I know a lot of patients who have been on these agents for years and doing great and have had a fantastic response. The problem, of course, as you well know, and you help us with this, is the side effects from chemotherapy, the GI, low energy, neuropathy, damage to organs, hair and skin, bone marrow suppression, intimacy is affected, and others. So that's why I so much appreciate working with naturopathic doctors who help the patients manage a lot of these side effects. Symptom management has advanced a lot. Pain management is so important. Apoptotic agents, stem cells, chemosensitivity, microbiome, metronomic chemotherapy, which is lower doses, and I'll show you some information. We'll talk about epigenetics. So here in the World Journal of Clinical Oncology from 2016, I tried to find an ASCO. I couldn't find anything yet about microbiome, but they talk about that they really review the evidence implicating microbiome involvement in the development of progression of non-GI cancers. We know that for GI malignancies, microbiome is important, but they looked in this study how the microbiome can affect and increase the chance of some non-gastrointestinal cancer. So microbiome is very important. Here, this colleague at USC, really, I love when I saw this in 2017, because for decades, I've been using low-dose chemotherapy for patients who are older or who've had a lot of chemotherapy or couldn't tolerate standard doses. And I've seen how wonderful it works. I mean, it's low doses of chemo are given to patients for frequent intervals over a longer period of time, and it's better tolerated. But I'm not saying this is not a standard treatment and it's not for curable cancers, but for people who have advanced cancers who've been through a lot of chemo, it can be magical. I've seen patients who are going to go on hospice, and we gave them lower doses of chemo once a week, and they had a miraculous response. So, by the way, all these things are what I share with my oncology colleagues, and you know, some of them will be open to it, but they're so focused on the science of following the book. Epigenetics, gene expression is influenced by hormones, metabolites, food, microbiome, chemical, drugs, environment, lifestyle, social interactions, relationships, thoughts, emotions, traumatic events. I mean, these are things that you understand and know the importance of all these things in epigenetics. In the ASCO education book from 2018, this doctor, he's a GYN, Dr. Eskander, talks about epigenetic mechanisms have emerged as important contributors to GYN progression. DNA methylation, histone modification, and non-coding RNA expression may be important contributors to disease progression and represent novel therapeutic targets. So he's been doing a lot of research and looking at all these agents as epigenetic treatment for GYN oncology. Briefly, definitions, we talk about CAM, we talk about holistic medicine. I love those names. Now, when we're talking with physicians that are more in traditional medicine, especially oncologists, it's great to talk about integrative medicine and integrative oncology because it really is a specialty. And I'll bring up in a few minutes about alternative medicine, that word. Cure and healing, for me, there are a lot of patients that are cured, we all know that, and they never feel healed. And so many people are living with cancer that we quote unquote don't know how to help and cure, but they feel healed. And that's our goal, is to feel healed. And I love this slide. Healing doesn't mean the damage never existed. It means the damage no longer controls our lives. Placebo, I heard once an fascinating physician talk for 2 hours about placebo. So I just want to put it here, the importance of placebo, the importance of nocebo, the negative effect, the negative effect. And he talked about meaning and context and expectation effect. So anyway, it's just a very important topic. When we look at clinical trials, when we look at treating patients, the placebo effect is huge. And we doctors in the medical field need to be looking at this more and more. So very briefly, a case presentation. This 47-year-old lady, internationally known holistic nutritionist with a rapidly growing right breast tumor. She had deep fear of allopathic conventional medical treatment and environment. She tried all types of natural approaches without success. I was honored to see her. She was referred to me for integrative consultations. This is several years ago. And I encouraged her to embrace chemo as part of her healing journey. And the way we communicated and talked about it is she did accept chemotherapy. She had a miraculous response with incredible reduction of her tumor in her breast that was oozing, and it was really, really infected. And then that was followed by surgery and radiation. And she did well for for many, many years. So that's about true integration, really embracing all approaches and therapies available. So integrative medicine is an emerging specialty. You know this well. I'm just putting this here. It's art and science of caring for the whole person, empowering patients to create a condition of optimal health, incorporate evidence-based natural therapies, safety and efficacy of these therapies. And more importantly, there's the Academy of Integrative Health and Medicine, AIHM. Some of you may be part of this. They just had an incredible meeting last weekend, which was fantastic. So I would encourage you, if you're not familiar with AIHM, look into it because it really is for all practitioners. Integrative oncology is basically integrative medicine in oncology. It's patient-centered, it's wellness and supporting the healing journey of cancer patients. It's very much desired and requested by the patients, family members, and society at large, and the cancer center staff. We also want to take care of the caregivers and in an optimal healing environment. And there's a very well-established Society of Integrative Oncology. They have thousands of publications of all the different modalities that help cancer patients. That's something to, if you want to look into. So at ASCO Journal of Oncology Practice, August of 2018, they talked about integrative oncology coordinates the delivery of evidence-based complementary therapies with conventional care, and that these therapies are broad range, mind, body, natural product, lifestyle, but more importantly, that ASCO is endorsing what the Society, SIO, Society of Integrative Oncology, is recommending. So this is really fantastic. Here's a definition from JCO, and you have it in your slide, but basically what integrative oncology is. It's patient-centered, evidence-informed, natural approaches. We don't need to get into the details, but you have it in your slide. So benefits of integrative oncology: less symptoms from cancer and its treatment, fewer visits to the doctor, improving the quality of life of patients and their caregivers, decrease in hospitalization, supports the medical environment, reduction of healthcare costs, education, research, and more importantly, collaboration. It really is about collaboration, and integrative oncology really is working all of us together, especially with all of you naturopathic doctors. So this is a very important article from the Journal of National Cancer Institute, November 2014. I recommend for you to read it. It's a retrospective data obtained from electronic records from a large Midwestern hospital over a period of 3.5 years. And they saw out of 11,000 cancer patients that were admitted, 17%, 1,800 received integrative medicine. And the therapies were body work, which was massage and craniosacral and reflexology. There was mind, body, and energy work. And third, there was traditional Chinese medicine. And this is incredible results. After receiving these therapies, patients average a 47% reduction in pain. We're talking about cancer patients hospitalized with pain, and 56% reduction in anxiety. So this is really an incredible study that whenever you give talks to medical practitioner, medical doc, or anyone in the medical field, this is a great article to quote. So the role of integrative oncologists like myself and others is creating an integrative plan with the patient during and after conventional cancer treatment, recommend specific modalities and practitioners. That's why I've so many times referred patients to naturopathic doctors over the years and decades. Help sort out so much data that's confusing for all. Advising patients about benefits and risks of all options in treatment, help them embrace chemotherapy and conventional medical recommendations, empowering them, supporting the oncology nurses and the cancer center staff, education, research, and collaboration with all practitioners. So here are just some collaborations here in California, several different institutions, and there are integrated oncology programs at the University of California, San Diego, Irvine, LA, San Francisco, at MD Anderson, Dana-Farber, Memorial Sloan Kettering, Johns Hopkins, Cleveland, and many others. So this is a great book by Don Abrams and Andrew Weil, where it's written by hundreds of practitioners of integrative oncology, and they have thousands of data. So this is briefly what I want to say about alternative medicine. I mean, the reason I don't like the word is because when I hear, and doctors, oncologists especially, hear alternative medicine, it sounds like someone that's doing something way out there on their own without being followed by anyone in the medical field. And this article from the Journal of National Cancer Institute talked about alternative medicine use was independently associated with greater risks of death compared with conventional cancer treatment. Of course, this is biased, but it does say it. The point is that we have to work together with cancer patients. We have to encourage them to embrace the medicines available. If they don't want to do some certain medical treatments, we can honor that, but at least to be followed with all their doctors, the naturopathic doctors, and all the practitioners that are with them. So integrated healing traditions, father of medicine, Hippocrates, osteopathic medicine is your naturopathic medicine, Ayurveda, TCM, Native American medicine, Tibetan medicine, and so many other healing traditions. I've really loved to work with all practitioners of all these healing traditions. So when a patient tells me, what can I do to prevent cancer or its recurrence? We talk first about lifestyle changes, nutrition, exercise, stress management, good rest, detoxification, feeling control, early detection, and consider several of the approaches we're going to talk about today. But more importantly, I'll tell them, work with a naturopathic doctor or with an Ayurvedic physician or a traditional Chinese medicine doc. But you are always on my recommendation. You are on my number one on my list. So let's start with a list of integrated modalities. We have always exercise, nutrition, yoga, which is not only the position, as you know, it's a whole discipline, it's a lifestyle, acupuncture, TCM, massage, support groups, meditation, biofield therapies. It's a long list. So the father of medicine said, let food be thy medicine shall be thy food. You know this, but these are slides that I also present to my oncology colleagues. There's extensive data in nutrition, whole food, plant-based, organic, freshly prepared. But more importantly is every patient needs to have a program that is individualized and customized. So I encourage them to talk to an expert nutritionist. Because there are special situations, carb restriction, ketogenic, intermittent fasting. But more importantly is every patient needs to see a nutritionist. I always tell them to make sure they create a peaceful, relaxed environment, no extremes, it's about balance. And then patients have told me this over the years, that they bless the food, the source, those who prepared it, and the company where it is. So I love that concept, and I put in my slides. This is a very, very good write-up from Dr. Dean Ornish And as you well know him, Dr. Dean Ornish did a pilot study in men with low risk prostate cancer who really wanted to be monitored and wanted to hold off on hormonal therapy and surgery. So they were on this intense nutrition and lifestyle intervention. And of course, there's going to be a significant improvement in weight and blood pressure and lipid profile. But more importantly, they looked at these genes, and they did biopsies on their normal prostate. And before and after the intervention, what they saw is these heat map, all the red genes are the ones that are more cancer-causing genes. So this post-intervention, these oncogenes, many different cancer genes, get down-regulated. And the green are basically, they're turned off. So this is an incredible presentation, write-up that I encourage you to look at or talk to any of your patient who is interested in looking at data in prostate cancer. You've seen this from the New England Journal of Medicine, intermittent fasting. I don't want to get into the details of it, but it was a fantastic, really a fantastic article. So botanicals, this is your expertise, so I don't have much to say. Dr. Warnock will. There are too many of them, but we know that they're powerful and they potentially can counteract medicine. That's why oncologists will tell patients, stay away from natural products. And what I tell my colleagues, oncologists, is when a patient is working with a practitioner that has experience, they'll know what natural supplements that patients can use during chemotherapy and which ones to avoid. So that's why it's working with practitioners with experience, and there are many of them, and all of you are. So curcumin, I think, is fantastic from turmeric. There have been clinical trials using it for cancer and how it can work. Probiotics, Ayurvedic herbs, traditional Chinese medicine. We use for mucositis, lysine, glutamine, you probably have some others, for alpha lipoic acid to prevent and treat neuropathy, aloe vera, ginger root is fantastic for nausea and vomiting and gastroparesis. Actually, there was one young man who was on aggressive chemotherapy for testicular cancer. This is 30 years ago. None of the expensive drugs worked, but the ginger root did. For altered taste, Ayurvedic doctors use ginger, honey, lemon, black salt, vitamin C, vitamin D. Dr. Warnock will talk about melatonin, aromatherapy, homeopathy, medicinal mushrooms. There's a long list that can be really powerful. Medical cannabis, mistletoe, and many others. Dr. Warnock will talk about mistletoe. But I want to show from the ASCO educational book in 2018. University of Minnesota and Johns Hopkins talked about care after chemotherapy, peripheral neuropathy, cannabis for symptom control, and they found that it says here, controversial but effective use of cannabinoids for cancer and chemotherapy, and it shows evidence of efficacy for treatment of pain and nausea. So this is in the Bible of oncologists. Another one, this is intravenous vitamin C in combination with chemotherapy and erlotinib in patients with pancreatic cancer from the JCO 2011. This was a phase 1 trial. It was a small number of patients, but they saw some efficacy. So this is, I mean, I just love to see this in our Journal of Clinical Oncology. Okay, I'm just gonna stop sharing for a minute because I wanna look at all of you. And I know you have your cameras off, but I just wanted to say hello and take a minute break. Hi, Tracy, hi, Bill, hello. Thank you for being here. I know there's a lot of information, but I hope that more than that, I can just inspire from the things I've learned from the patients. So let's keep going here. All right, so yoga. From the Journal of Clinical Oncology, April 2014, randomized study, yoga in breast cancer undergoing radiation therapy. There were 110 patients with fatigue, depression, and sleep. It showed that improved quality of life, significant improvement in those who had were undergoing yoga treatment. Yoga's impact on inflammation, mood, and fatigue. 200 breast cancer patients, they measured pro-inflammatory cytokines, and they saw there was significant improvement. Journal of Clinical Oncology, 2014. All right, let's move on to early acupuncture. My neck suddenly feels better. I love this slide. So TCM, it's a whole system approach, you know well. There's extensive literature, improves symptom caused by cancer, mitigates side effects, attenuates toxicity, enhances therapeutic effect, and restores health and well-being. We've used in our cancer center, I'm going to show, I have a slide later, but we've had all these modalities in our cancer center in Vista and Encinitas, San Diego, where we were using traditional therapies, chemotherapy and everything traditional. We were using all these modalities for free, thanks to incredible volunteers, practitioners that volunteered to help the patients. So a lot of them love the acupuncture. It helps pain, xerostomia, dryness in the mouth from radiation, nausea, vomiting, anorexia, weight loss, hot flashes, neuropathy, fatigue, stress, anxiety, depression, regulates body symptoms, makes people feel great. Here from JCO, May 2016, randomized study in hot flashes in women with breast cancer. They looked at 190 women. They saw significant improvement with acupuncture. For pain and dysfunction after neck dissection, 58 patients showed significant improvement with acupuncture. Randomized in women who are on aromatase inhibitors, joint symptoms, acupuncture, 51 patients had significant improvement. JCO from December 2012, cancer-related fatigue, 300 patients also improved with acupuncture. Let's move to massage. We know it works. There are many reasons to use it. When my oncology colleagues say, no, you can't use massage, I tell them, listen, and therapists with experience will know how to deal with potential infections, DVTs, bone metastasis, skin sensitivity. So it can only help. I mean, my goodness, I've seen patients do so well with massage in the right hands and a massage therapist with training in oncology. It's miraculous how they feel. So here's from the ASCO journal, January 2017, massage in the chemotherapy infusion room at Memorial Sloan Kettering, how this can be safely and effectively integrated into chemo infusion to provide symptom relief. So again, all these slides, it would be great if you use them for some of your presentations, because these are all from the Bible of oncologists. Support groups, very important. Patients, caregivers, children. It's all a team approach. The metastatic breast cancer patients created a group in LA they call them Metathrivers. Incredible group of women. Dr. Simon, you may have heard of him, psychoneuroimmunologist, has written a book, Getting Well Again. And then there is an APOS, American Psycho-Oncology Society, that has great meetings, great presentations, all about psychosocial oncology. So let's move on to empowerment techniques, visualization, guided imagery, biofeedback, virtual reality. I'm adding that because there's more and more evidence of that. Mindfulness. John Kabat-Zinn is one of the pioneers, but there are many others, and meditation, many disciplines. So in the Journal of Clinical Oncology, August 2021 at UCLA and Harvard and Johns Hopkins, they talked about mindfulness, meditation, and survivorship education in 247 women and how it really helped them in cancer survivorship. Journal of Clinical Oncology, September 2020, this is recent, a year ago, Thomas Jefferson University and UPenn. They are talking about during COVID, healthcare workers are not only at high risk for contracting the disease, but are also significant risk for depression, anxiety, insomnia, and distress. And we know how much burnout, depression, and suicide there is in healthcare workers. So there's existing evidence of the use of meditation and mindfulness practices, not only for the patients that we've been talking about, but for the healthcare professionals, including oncology healthcare. So from JCO, May 2016, mindfulness in breast cancer survivor, 322 patients, how mindfulness helped a broad range of symptoms improvement. Mindfulness for stage 0 to 3 breast cancer, JCO 2012, 230 women, improved mood, breast and endocrine related quality of life and well-being. Now, this is something very briefly I want to say, because Elizabeth Blackburn is a Nobel laureate who's done a lot of meditation, studies on meditation and genetic changes. Sorry. Here we go. Here we go. Okay. Uh, Meditation may slow genetic aging. They talk about the telomere changes during meditation, and this has been an incredible work that they've done, and they presented this at the Annals of Science, Academy of Science. Let's go to energy medicine, what we call biofield therapies, healing touch, therapeutic touch. There's several different names, techniques. It's really professionals with specific experience, and I know many of them that do incredible work. You also do. JCO, February 2017, talked about healing touch. And basically, I love to see this in JCO. It's a specific energy medicine modality that incorporates several techniques to balance human energy fields to help promote healing, pediatric survivors and their families, and how healing touch helped. So I always send these articles to my oncology colleagues to remind them. There's this article on biofield science and healing written by a lot of different multi-institutional. It really is a very interesting article from November 2015 of Global Advances. And then there's this nonprofit I've been aboard on, Consciousness and Healing Initiative. It is a nonprofit collaborative of scientists, practitioners, educators, innovators, and artists to lead humanity to heal ourselves. And they're practitioners of all the healing arts that are part of this nonprofit. I wanted to bring Faye here, Qigong, because she's an incredible Qigong master here in San Diego for decades. And she came every week for 10 years to our cancer center to do Qigong with the patients while they were undergoing chemotherapy. This was a special room. You're gonna see where the chemo suite in another slide, but they would come to this audiovisual room we had for meetings, and she would do Qigong there every week. So our friend Nikola Tesla said, if we want to find the secrets of the universe, think in terms of energy, frequency, and vibration. So continuing with our list, integrative pain management is very important in cancer. Physical therapy, craniosacral, art therapy, pet therapy, music therapy, laughter, grounding, connecting with nature, spirituality, power of prayer. But grounding, we know how important it is. And this at ABIHM presentation last week, actually, Jamie Harvey and Dr. Mimi Guarneri talked about this model of ecological medicine and honoring indigenous healers and our health. So this is the ego model, and this is the eco model. And I love this slide. I've been sharing it with my kids, with friends. I wanted to share it here. Some of you may have been at this conference, virtual conference last week. Dr. Larry Dossi wrote this work, Healing Words. I had it in always in the exam rooms, The Power of Prayer and the Practice of Medicine. And then our dear Mother Teresa, Everything Starts from Prayer, Meditations on Spiritual Life, People of All Faith. So here's Dr. Alessandra Colfi, who's been doing art therapy for 20 years here in San Diego. She did art therapy at our cancer center. Now she's at many places. Our cancer center is part of UCSD. I'll get into that later, but I'm not there any longer. I needed to focus on integrative oncology and myself and my family. But this is a group of art therapy. Here they are at our cancer center. This is a very emotional, artful bra, honoring women who had mastectomy. They were doing these artful bra projects, and we had these hanging in the chemo room in our cancer center. And here they created these purses. Every time I look at this, it brings me tears, thinking about what a way to honor women who undergo mastectomy. There are also these prayer flags that are called Hope Made Visible. They're visible. There are 2,500 flags from all over the world, actually. Here they're doing this with Alessandra at the cancer center. They were presented at different institutions and hospitals. But anyway, it's a beautiful program, and this is their artful journal. So, Journal of Clinical Oncology from last year, 2020, talks about art therapy improves quality of life and symptoms in patients with cancer. And they say that it should be recommended it should be recommended by all cancer centers. JCO, 2015, music therapy and ambulatory breast surgery, 200 patients, how It helps manage preoperative anxiety. And Dr. Larry Einhorn, some of you may have heard of him, in JCO August 2017, he's the founder, he created and invented the cure for testicular cancer, the chemotherapy regimen cure at Indiana University. He wrote this, that he said, I turn to love in all its many forms as a compelling force helping our patients combat the uncertainties associated with cancer diagnosis. Love can provide comfort in troubling and unpredictable time, and he's honoring the courage and resilience of the patients. Beautiful article from Dr. Larry Einhorn. Another case presentation, 45-year-old lady, progressive disease after multiple forms of therapy. By 2007, no other medical options were available. She had a near-death experience with 2 brain surgeries, developed blindness, was cared for by her father. She was basically told there was nothing else to do, to go basically on hospice. Meditation, visualization, and prayer. She surrendered. She was referred to me by by Dr. David Simon from the Chopra Center. She was just taking some herbs, and she said that she was aligning herself energetically with whatever was available to help her body heal. She was vibrating. She said, I'm vibrating at high healing frequencies. I have to tell you, this was one of the miracles, many miracles that I've been honored to see. From November 2007 to October 2008, a PET scan where she had some disease in her breast, in her axilla, in the middle of the chest, in the neck, a lot of involvement in the right sacral area and the pelvis. And just by her connecting and meditating and praying, she couldn't afford anything else. I mean, just the herbs were actually, most of the time didn't take them and wasn't eating healthy because her father was cooking and it was really not a very healthy diet. And there was improvement. And this went on for a few years. So I just wanted to say, I understand how this can happen epigenetically and in many other explanations, but it's just wonderful to see these miracles. Patients talk about blessing of their water, food, medicine, supplements, chemotherapy, radiation, everything and everyone. And I just love the concept. I try to remember it. When we talk about integrative modalities, what are the mechanisms and effects? I mean, it's so complex. They're immune modulating, all these modalities can be any of or a combination of these. Immune modulating, anti-inflammatory, endorphin producing, hormone regulating, antioxidant, induce apoptosis, anti-angiogenic, epigenetic, restore balance. But mostly it is practitioner dependent. And that's why we know some healers, really doesn't matter what art they do, but they can be, when they're true healers, they will influence those patients and will help them on a heart level, on a soul level, on an energetic level. So what I tell patients is through your meditation and intuition, find those integrative professionals and teams who are powerful healers and the treatments that will help you feel empowered and support you in your healing journey. Now, one of the best healers is here. Gracie would come to our chemo room twice a week with her mama, Norma. So here she's healing with her kisses, and Gracie for years would come to our chemo room. And then another dog, Isabella, with Terry would come to the chemo room. Very powerful healing practitioners, healing practitioners. So the integrated program we had at our cancer center was created in 1995. It was co-created by practitioners of all the different healing arts who volunteered. And we gave the free therapies. We had 150 visits per week, around 200 cancer patients per month, and up to 50 active volunteers enrolled at one time. And this went on for 20 years, from 95 to 2015. So this was a model of what really is possible, working under the same roof with all the medical oncologists and radiation oncologists, with all these wonderful healers. So this is the chemo room where the chemotherapy was given. Even the nurses would pray silently before, after, and during and after giving chemotherapy. One of the many private rooms where acupuncture, massage, Reiki was done. Here's one of the wonderful ladies who really took advantage with her daughter of a lot of these modalities. So we had regular meetings with the practitioners of all the healing arts. We learned so much from each other. and program for patients and practitioners. We had appreciation dinner twice a year, created an optimal healing environment. And now during the pandemic, we meet by Zoom. So here's one of the dinners we had, and we got together. So some of them would come with their pets. These are the nurses really wearing their costumes in different events to cheer up the patients while they were getting chemotherapy. So, importance of taking care of ourselves, applying the wisdom of all healing traditions, I need to practice what I preach, seeing patients as our teachers, crying with the staff, patients, and grieving. We've done a lot of crying with the patients and our staff. Otherwise, there's a high risk of compassion fatigue and burnout. Now, we know there are challenges in the medical environment, and then there is really the accepting cycle, life and death. I have a poem, we won't have time, that one of my patients wrote. A young lady that had advanced cancer wrote a poem when she was 18. Beautiful poem. I want to honor Carl Simonton, David Simon, these two docs who helped thousands of cancer patients and are now watching from above. Tom Chippendale, a neurologist who did so much work in meditation with patients. Jeremy Geffen, you may have heard of him, and worldwide known integrative oncologist who passed in 2015. Here's my nephew and godson, Nick, with my two daughters. He had advanced cancer 11 years ago, and he was living with us during the challenging times of cancer, and he was an inspiration. This is all during cancer. He was always with a smile. Here he had 103 fever. My daughter lying down with him. Every time I see this, I get really emotional. And this is the pet that we got when Nick was just ill. And this is Darwin. He's still with us 11 years later. So with challenges with cancer, we can do everything right, and people still develop cancer. We talked about the random mutations. Children with cancer, healers with cancer. We've all worked with healers who have cancer. They do everything right, and they still deal with cancer. Resistant tumors, recurrent tumors. It really is importance of quality of life and the blessings of palliative medicine, hospice teams. But there's always hope. This lady, 37-year-old, widely metastatic ovarian cancer, progressive disease after multiple different chemo, I'm still emotional. 2001, poor general condition, poor performance status. She signed up for hospice. She was deteriorating, went into a coma, agonal breathing. Her husband was there, the two little girls. I went to see her at her home. This is 20 years ago. Well, the hospice nurses were there. We were just supporting the patient. She was in a coma, supporting the husband and the girls. For several days, it was agonal. I called him that night and he said she's still agonal breathing. This went on for days. And then she started to get better. She awoke from the coma weeks later. And after 6 months, she was almost back to normal. So how did this happen? So that's why there's always hope when I tell you know this, but I tell my colleagues, oncologists, we can never tell people what their life expectancy is. We have no idea. It's in their soul's hands, God's hands. And Albert Einstein said there are only two ways to live a life. One is that there's nothing is a miracle. The other, that everything is a miracle. So for those who have or had cancer, I tell them honor all your feelings, everything, fear, anxiety, sadness, anger, shame, honor them. Let those emotions move through. Trust your intuition, your inner wisdom. Be with those who make you feel good. You are unique. Please do not compare yourself with others. Accept help. Cancer patients are always giving. Professionals are doing their best with the resources they have. Oncologists, they really are doing their best. And for the patient to see medicines and chemo as healing treatments, visualize the potential for infinite possibilities and healing. And there's always a condition we call incurable. At this time, there could always be an answer around the corner, and spontaneous remissions happen. So how do you really know? You know how to support someone with cancer. It's just being present, knowing about healing and curing, respecting their beliefs and differences, supporting them in creating their own optimal healing environment. And a lot of it is nonverbal. when we know that we have hope, faith, they will feel it, like being an alchemist, like the prayer of St. Francis. And there's this about entrainment, limbic resonance, and mirror neurons. I tell my oncology colleagues, we have to believe that our patients can do well because they're going to feel it. Non-verbally, they're going to feel it if we don't. So we won't have time to do this exercise, but I want to leave it to, you know this, you read it, and here's the incredible picture from the Hubble telescope. I just want to say, I mean, Dr. Damien Rush gave a great presentation, but I just want to say during the pandemic, as healthcare practitioners, we do have the responsibility to protect the patients, families, communities, and society at large. So prevention is critical, of course, but then the vaccination, COVID vaccine, especially in those at high risk and cancer patients, I really highly recommend it. There are resources in the CDC. Again, at ASCO, they talk about COVID, and they really refer to the CDC. They have a lot of other information. So this is a daily ritual. I tell patients, make your own ritual. You can use this as a guide, but every day use a ritual. Talk about it with your naturopathic doctor, with your other practitioners, and create a daily list. First, stress management. We know how important that is. Stress reduction, good sleep, plenty of rest, doing some meditation, reflection, prayer. Optimize nutrition, some form of exercise, grounding, being in nature, honoring their emotions, feeling empowered, and then sense of purpose or gratitude. This slide is for me, okay? Because I need to learn from you. So that's why I put it here. Summary, honoring our bodies need to rest, recover, and heal. Meditation, embracing uncertainty, practicing healing modalities regularly, one or just a few. And I tell patients, don't become overwhelmed by all, just maybe do one of these modalities or just a few. But and on a daily and weekly basis, our body and our soul will guide us to do different things. And just adding to the toolbox, techniques, experiences, lessons, embracing all wisdom, medicine, and all healing tradition, feeling in control, feeling empowered, balance, connection, and know that they are loved. So I just want to thank INM, A&P for this invitation. I want to thank the staff, nurses, and volunteers at our Cancer Center and Institute, honoring all cancer patients, angel nurses, incredible. Nurses are the best. Caregivers, caretakers, volunteers, researchers, Centers for Integrative Medicine, my patients, my family, my friends. And this is the island of Kos, where Hippocrates was born. So that's it. I'm going to stop sharing. I'm so honored to be with all of you. Thank you. I know we have a few minutes, I think. Yes, we have a few minutes. Fantastic. Thank you for listening. Thank you for your patience.
So we can take questions if you'd like to.
Absolutely.
So does anybody have any questions?
Hi, Tracy. Hi, Bill. Hello, everyone.
I do have a question, actually. That was an amazing talk. Really appreciate how dedicated you are to your work. So beautifully said. My question is actually in regards to a test I recently was told about, and I'm sure you're aware of it, is the Gallery test or the Grail test. I don't know if you can comment on that, but I'm curious about your thoughts on utilization for screening.
You know, I'm going to have to look into it.
Great.
I've heard of it, but I don't want to talk when I don't know too much about it. So
sure.
What's the test again? It's the
the company is Gallery. And
yes.
And so they have been doing quite a bit of research in this area. So oncology is definitely not my forte, but I'm curious where it goes.
I'll find out. And Michelle, I'll get back to you one way or another.
Perfect.
Yes. Thank you for that question.
Thank you.
Yes.
While you're thinking, I did want to say that I really am not looking for business or referrals. I remain very busy myself with several integrative projects, research and education. And I've had some health issues myself. So I've taken time to do what I've been preaching for the patients, really take time for my healing, my well-being, taking time to be with my wife, our kids. We have 3 grandkids, friends. And at this time, I actually have a few dear friends who are dealing with very serious medical issues. So I do some consults occasionally, integrative oncology consults. I'm not looking for them. They come and, but I'm staying really busy. So I'm not looking for a referral. I'm just honored to do this and share what I've learned over the decades, and especially from our enlightened patients. Someone was going to ask something, I think. I'm looking forward to Dr. Bill's presentation. I'm going to learn a lot. I continue to learn. But anything else? Any burning questions? I know I covered a lot. You're going to have the recording. You have all the Yes, Kelsey.
Hi there. Thank you for that amazing talk. And one of the things I so appreciated about it was really the permission to step into the healing process with our patients and to be vulnerable, to have our emotions as we're going through. I've had a number of patients who have, I don't work particularly in this space, but have supported several dear patients over time through it. And I just felt like your presentation really spoke to the heart of what I was very honored to experience working alongside some of these patients. So thank you for that. I'm curious, you mentioned all of these different, things of supporting patients and prevention of cancer and this type of thing. And I'm wondering, with your years of experience and, discernment and seeing all these modalities play out, I'm curious if you settled on kind of maybe your top favorites. I'd love to just hear some of your things that you would either guide us as like, look, these are most effective things, or for our own, maybe even personal health of really helping us to, prevent cancer on, our own health journeys.
What a great question. I mean, it's a key question. Thank you for your comments. Thank you for the question. And I have to humbly say, what I've seen help cancer patients, it's different for each one, but it is practitioner dependent. I've seen patients go to a specific naturopathic doctor, a specific integrative doctor, a specific functional medicine, a specific energy practitioner who was able to help them click in their energy field, in their molecules, epigenetically. I mean, everything we talked about. So it really is different for each one. So for me, I mean, what I've done, I've just been so honored to learn Ayurveda, traditional Chinese medicine. I worked with shamans, and ultimately I realized that I just need to sit, meditate, pray, be out in nature, eat healthy, avoid stress, be with the people I love and love me. And that's a little bit what the list of those. So and this is what I really do tell patients. I say, just work with a practitioner you trust, and they will help you find your own healing, and follow your intuition. And through meditation and all that, your body will tell you which supplements help, which practitioner helps, what discipline, what helps, what videos to watch, what books to listen to, what music to listen to. And that's how I've seen the miracles. And I'm so grateful that you asked that question, because I humbly have to say that there are so many ways to heal. And that's why I've encouraged, in our integrated program, we had all these practitioners, but now when I consult, I tell people, go over this list and see what resonates with you. But in our conversation, I will immediately feel and tell that they really need a naturopathic doctor, or they know already an Ayurvedic practitioner. And then I'll open them up and say, you know, consider looking at this or that. So I'll give them a list, but in our hour-and-a-half conversation, we'll come up with what resonates with them most of the time. If they don't have experience with integrated medicine, it becomes more complicated. But thank you. That was a great question, and I'm really grateful. And I'm just grateful for this opportunity. And it's 2:30. So thank you, everyone, for your patience. Thank you, Tracy. And also thank you to Dr. Joy Hardison, who invited me to give this talk today. But I'm grateful for all of you. I'm honored, deeply honored.